afternoon, everyone, and welcome back to our daily media briefings. I hope everybody had a very enjoyable weekend, and we're glad to have you back with us. These next 2 days will be very important in terms of our ongoing effort to get this region moving again. Earlier today, you heard Governor Newsom talk about changes in the regional variance formula that could be used to help counties move faster towards reopening. What this means for us is something that our staff is still reviewing, and we expect to get further clarification tomorrow at our Board of Supervisors meeting. County staff will be giving us a comprehensive update on where we are at this stage of our fight against the pandemic, and we will additionally be hearing about the governor's latest updates. I don't want to jump ahead of our staff report, but I have to tell you, I'm very optimistic. As we've seen, our testing is increasing while the percentage of our positive cases is remaining low. And while our hospitals are very busy, we have managed to avoid a situation where they are overwhelmed. We know everyone is anxious to get a full reopening of our region over the next couple of weeks. And we have, in concert with the state, allowed more businesses to reopen with restrictions. We have also announced office openings for the county government and door-side service for some of our county branch libraries, and allowed the use of beaches, parks, and campgrounds, again, with restrictions. Supervisor Fletcher is now going to go into more detail about the governor's announcement, so let me bring him up at this time.
Thank you, and good afternoon. Throughout our reopening process, we have moved responsibly and in a phased and systematic approach. We have strive to strike the very difficult balance of the dangers of coronavirus and the negative and very real impacts on our economy and our way of life. To try and find the balance that allows us to reopen, to try and find the balance that allows us to move forward, to try and find the balance that restarts our economy, protects public health, but most importantly, to try and find the balance that allows us to continue to move forward. Both the lessons of history and the lessons of some other places around the world are that moving too fast, too swift can lead to a second wave, and a second wave can re-trigger restrictions. And that would not only be devastating for our psyche, it would be devastating for economic recovery. And so we continue to try and move in the most appropriate manner, balancing all of those various factors that we see. In this same spirit of moving responsibly, of moving in phases, of moving in a thoughtful approach, today Governor Gavin Newsom announced new criteria that, if met, allow for counties to continue all the way through stage 2 reopenings at their own speed. We believe that we meet these standards, but we will wait for a formal briefing by our public health officer at tomorrow's County Board of Supervisors meeting. If we are allowed to move forward, it could be very rapidly in opening and allowing these new entities in San Diego County. And the major entities remaining in stage 2 are in-person dining and in-person retail. In addition to that step, which we believe we could make in the coming days, the governor alluded to the possibility of moving into stage 3 in early June. He specifically cited hair salons, counseling and church services and sporting activities as things that he believes, as our current trends continue, will be things coming in weeks, not months. And so this is encouraging progress. Today, when the governor provided new guidance for counties, it was around issues of stable or downward trend of hospitalizations, being that hospitalizations of COVID individuals on a 7-day average have a percentage change of less than 5%. They also alluded to cases, less than 25 new cases per 100,000 residents in the past 14 days, or less than 8% testing positive in the past 7 days. And in a large county where we're doing a lot of testing, we do rely on this percentage of positive and not the total number of positive cases that are done. He also alluded to testing capacity, which we are striving valiantly to get to our goal of 5,200 per day, which is in line with the state's goal of 1.5 per 1,000. They talked about contact tracing, which we are also moving forward with, hospital surge capacity, which we monitor and track daily in the chart that you'll see in a few minutes, efforts around skilled nursing facilities and vulnerable populations, along with personal protective equipment. So again, we believe we meet these standards, but our public health officer will provide a formal briefing to the Board of Supervisors tomorrow. But if we are cleared based on these standards, then we believe in the coming days we could see progress around in-store retail and dine-in restaurants. Now, for all of these entities, they need to be prepared to move quickly in the event we get the okay to open. You'll want to create our safe reopening plan, which is at the county's website. And you'll also want to download the state of California's recommendation and guidance for both in-person retail and dine-in restaurants. Those are available on the state of California's website. And so if you are in those entities, I would download those guidance, I would look at our plan, and I would stand by to be able to move as rapidly as possible. And again, this is just stage 2. We think could happen in the coming days. And we are encouraged by the governor saying he believes in stage 3, that could be coming in the early part of June, which I know will alleviate some anxiety in terms of what's happening. In a minute, I'm going to jump into our testing numbers, but I want to just quickly pay reference to the progress we saw over the weekend. Yesterday, we reported 4,362 tests. On Saturday, we reported 4,505 tests that were performed each of those 2 days. We report the tests reported to us, both positive and negative, not the tests that were conducted that day. And so as we've seen over the preceding weeks and months, we tend to have a little bit of a dip on Monday or Tuesday, as there's a little bit testing done on Saturday and Sunday. But I do want to recognize that continued progress that we see around our testing and around the continued stepping up that we are having moving forward. I also want to outline we have free testing available at 4 different locations through our partnership with the state. That's a capacity of about 800 tests a day. New is the Tubman Chavez Center in Southeast San Diego. That opens tomorrow. Also new is the former County Assessor's Office in El Cajon. And then continuing is the former Sears Building in Chula Vista and the county's North Inland Live Well Center in Escondido. You do not need a doctor referral, and in a minute, I will share the link, website, and phone number one more time. You can sign up for this testing. Quick update on homeless testing at the convention center to date. 1,594 tests have been administered at the convention center. That number has not changed since was reported out Friday. We have had reports come back, testing results come back, and since Friday we've had 342 additional negative tests. We have had no change in the number of positive tests. The number of pending results have come down, and the number of indeterminate tests has gone up 4. And so we will continue to update you on all of those. Now we'll jump into our T3 chart to give you a sense of where we are this weekend. We crossed the threshold of more than 100,000 tests having been performed in our county. Our daily total today is 3,408. Again, we were in the 4,000s both Saturday and Sunday. It's common Monday, Tuesday, we get a little bit of a dip, but we are continuing to advance. Contact tracers, you see 235. Again, we continue to build out this workforce, and it continues to increase very consistently with the increase that we see in testing, and those two numbers do go together. We're presently treating 159 individuals in our public health motel rooms, and that is the third T, testing, tracing, and treatment. If you would like to sign up for testing, on this next chart, you can see the information. You go to that website, lhi.care/COVID testing, and you can sign up there. You see the 4 locations that are available for testing, the 2 new ones, the Tubman Chavez Center in Southeast San Diego, the former Assessor's Office in El Cajon. We also have the existing location in Escondido and the existing location in Chula Vista, and all 4 of those will remain in operations for the foreseeable future. You don't need a doctor's referral. You must have an appointment, and if you don't want to utilize the website, you can call the 800 number there you see on your screen to get scheduled. Today we're reporting 110 new positive cases. This is out of the 4,408 tests that were performed for a 3% average. Again, our rolling average is 4.1%. You see over the weekend we were averaging 3% and then 4% relative. We expect this number to continue to trend downward as we continue to increase testing. And again, if you look at this chart in totality out of the day-to-day numbers, you can see we are stepping up our testing. We had a range in the 2,000s, range in the 3,000s, then we had a number of days in the 4,000s, and we want to continue this progress as we strive to hit our initial goal of 5,200 tests per day. On the daily hospital census there, you can get a sense of where we are at 150 COVID-related ICU patients presently, and 380 total COVID patients in our area hospitals. Again, these are remaining generally flat, which you see over time, slight increase in ICUs over time, but generally remaining very, very stable. Next, you will see the COVID-related patients at 380, non-COVID on top of those, and that's where you see that healthy differential between total current hospitalization and current bed capacity. That is one of the metrics the state is looking at in terms of how much surge capacity do you have in the event that you saw an uptick in cases. And then our final chart here is just our cumulative totals, both positive, estimated recovery, hospitalizations, ICUs, and 211 are the number of COVID deaths in San Diego County. It is actually 211. It is all 211. And our deepest condolences go out to the family members of those 211 individuals who have died as a result of the COVID outbreak. Now I'll turn it over to Dr. Wilma Wooten for a Public Health Officer's report.
Good afternoon, everyone, and welcome to our Monday media briefing. The global, national, and state statistics today are based on data that we obtained from the Johns Hopkins dashboard, and this information was obtained about noon today. And globally, there are over 4,700,000 positive cases, which includes almost 317,000 deaths. Nationwide, the United States is reporting almost 1.5 million positive cases, or 31% of the total global numbers, and these include almost 90,000 deaths. Statewide, California is reporting over 80,000 positive cases, which includes 3,240 deaths. And today, May 18th, the County of San Diego is reporting almost 6,000 cases, 5,946, which is 110 more cases than reported yesterday. And this includes 211 deaths, which includes 2 new deaths reported since yesterday. The age range for all of our cases still remains from 3 months to 101 years of age. The age range of 20 to 49 years of age still represents about 52% of the total number. And the total cases are represented approximately 50-50, 50% female and 50% male. We have 1,115, or 19% of the cases have been hospitalized, and of that hospitalized number, 339 have been admitted to the ICU, and this represents 6% of the total number of cases and 30% of the total number hospitalized. For the 211 deaths, these represent approximately 4% of the total number of cases. And the 2 additional deaths today are represented by 1 female in her early 70s and 1 male in his early 80s, or rather late 80s. Both had underlying medical conditions. Of all the 211 deaths, 44% were female and 56% were male. Regarding race and ethnicity of all deaths, we have data for 98%, which is 206 of the 211. The numbers have not significantly changed from previous reports. And of the total, 95 or 46% are white, 88 or 43% are Hispanic or Latino, 15 or 7% are Asian, and 4 or 2% are African American. 2 are slightly over 1% are Pacific Islanders, and 1 each is reported, or deaths are reported for American Indians, and 1 of multiple races. So condolences, as always, go out to the family and friends of those individuals that have lost their lives to COVID-19, both reported here today and throughout the pandemic. As a reminder, all of this information, including our demographic data, is available on our county website at the bottom of the slides and in the sign before me. In regard to reported outbreaks in congregate and community settings, to date there have been a cumulative number of 73 confirmed active outbreaks. Of these active outbreaks, 50 are in congregate facilities with a total number of 1,318 cases, which includes 104 deaths, and 23 active outbreaks are in community setting locations, which includes 310 cases and 5 deaths. Local metrics continue to trend in the right direction. Documentation is being ready to present to our Board of Supervisors tomorrow related to attestation for the accelerated stage 2. The county meets the modified metrics that have been shared with us by the state, and we will continue to monitor the required and other metrics to inform our next steps in further opening of local businesses, organizations, and activities to strike a balance between the protection of the public's health and economic viability for our region. Thank you. Please now welcome back to the podium Chairman Cox.
Thank you, Dr. Wooten. We'll go straight to the calls. And again, if we don't identify you by name and outlet, please do so before you ask your question.
Priya Shriver with NBC7, please state your question.
Hi there. I have 2 questions. One, could you clarify the positive percent average? Is the 3% out of the 3,408 cases or 4,000 cases?
Okay, Supervisor Fletcher is going to respond.
Thank you. Priya, if you look at the chart that we put up today, I'm just going to, maybe we can pull it up on the screen for you here, just to walk through where it is. Let's give our folks a second here. Yeah, let's do the percentage positive. So what you see right there is you see today we're the 110 positive out of the 3,408, and above that is 3%. 3% is today's total. If you go to yesterday, you see 174 out of 4,363. There's a 4% above that. Yesterday was 4%. The day before was 3%, 3%, 3%. So you can see each day what the total is, and then what the purple line represents. And if you look at the bottom of the chart there, you'll see in the footnotes there that rolling average percentage for a 14-day time period. And so the rolling average presently for a 14-day time period reflected in the purple bar there is 4.1%. So there you see the rolling 14-day average, and then you can see the numbers each individual day. Does that make sense?
Got it. Thank you. And a follow-up question, unrelated. I know you guys had mixed feelings about the casinos reopening. Today, a few of them did, and we're hearing that at VA House there were lines out the door and that they reached capacity, which has obviously been modified capacity, by 11 a.m. this morning. Do you guys still feel like it's safe for these places to be open right now?
Well, I think we've addressed our thoughts on this at great length last week. I don't know if Dr. Wooten has anything to add, but I think that this has been addressed from a public health standpoint, but I'll let Dr. Wooten comment.
Great question, and while we may not agree with the actual opening, and I actually have not seen the plan from VA House, but I have seen Hamul and Saquon, and we're waiting on 1 or 2 others. As we have stated before, we are not in agreement, but we do not have a jurisdiction, so the best thing that we can do is review the plans and ensure that there are at least measures built in to prevent the spread. And those 4 significant strategies include screening, number 1, and then social distancing and masks, and then sanitation and hygiene. So, and I have been looking for that in the plans that I have reviewed. And the other thing that we have, the thing that we can do, that we have to do now is just make sure that we are monitoring any potential outbreaks in those facilities.
Okay, let's go to the next question.
David Gottfredson with Channel 8 News. Please state your question.
Hi, I had a question for Dr. Wooten. I noted that I think the tally is now 4 state-run test sites and 3 county-run test sites, which are offering free testing in the county starting tomorrow. These tests are nasal swab tests only. And can you please confirm that it would make no sense for somebody who has had COVID-19 and recovered and has no symptoms, it makes no sense for them to go to one of these sites and have a nasal swab test? Is that an accurate statement?
Okay, Dr. Wooten will respond.
What I will say is that, and actually, we've been providing free testing since the onset of any of our drive-through facilities. So that's number one. In terms of someone who's been tested before, I don't know that we have enough evidence, as has been reported on the news about the individuals on the Roosevelt ship. We just don't have enough information right now. The drive-through and walk-up and mobile testing is reserved throughout the county for those individuals that might be asymptomatic and are in high-priority areas, and that information has been disseminated to healthcare providers before, as well as testing of our essential workers with and without symptoms. So that is our primary focus for all of the testing modalities that are currently in place.
Right, but I just wanted to follow up. So none of the county or state sites that are offering free testing now are offering antibody testing for people who have recovered. And my question is, does the county have any plans in the future to offer free antibody testing so that somebody who's recovered can figure out whether they had the virus in the past? And I'll have one more follow-up after that.
Right now, our focus is on identifying and looking at what's going on in the community. As part of our laboratory task force, there is a work group that is focused on serology testing, but that is not our priority at this time. We do have a work group working on that. Right now, our priority is getting up to the 1.5 tests per 1,000 population, which is just under 5,000 as prescribed by the state. So that is our primary focus, as well as surveillance in the community. So we will eventually focus on serology testing, but we also want to utilize a test that has been approved by the FDA and has good specificity and sensitivity.
Well, I understand that there are some antibody test sites open right now, and they are approved by the FDA. And you can also go to like Quest Diagnostics or LabCorp, which are very well-known companies, and get serology testing. Are those are going to cost you money, of course, but are those included in the county numbers? For example, if one of the COVID clinic site downtown does serology testing, and or if Quest Diagnostic tests somebody in San Diego with an antibody test, are those numbers included in the county numbers that you present every day?
So 2 questions. No, all of our tests that we present every day are diagnostic tests performed by PCR, polymerase chain reaction testing, diagnostic tests. We are not reporting any serology test. And while there might be some tests that are out there, again, we want to land on the test that has the greatest specificity and sensitivity and that our work group lands on. So right now, that is not our priority. We recognize that it may have utility in the future, but right now we are focusing on local surveillance and identification of those individuals that are positive due to having symptoms or have no symptoms but are positive, so we can remove them from the population and help decrease the spread. That is our primary focus today and at this time. And then the second question was related, and I'm blanking on what the second question, I actually have forgotten what the second question was. Did I answer both or not?
I think so, but I'm still a little unclear. If you think you might have had it, or a family member of yours might have had it, and you know maybe you think you've recovered, it really doesn't make sense to get a nasal swab test, does it? Because your symptoms are already
we're not
gone,
asking,
right?
those are not the people we're asking if they know that if they've been diagnosed with COVID, there's no reason for them to get a nasal swab. They might want to get a serology test if that testing is available, but right now the county is not providing serology. Our primary focus is diagnostic.
Thank you.
Okay, this first texted question deals with the Phase 2 reopening of businesses, and Dr. Wooten's going to respond.
This is from Brittany Mealing from the San Diego Union Tribune. If San Diego County meets Governor Newsom's new requirements to reopen Phase 2 businesses, how long will it take for the county to file appropriate paperwork and officially move forward? Are we talking days or weeks before businesses can reopen?
We're talking actually hours. I have an appointment early evening today to present our plan before we present it to our Board of Supervisors tomorrow. And we do meet the new metrics that have been created for urban and larger public health jurisdictions.
And this question from Lori Weisberg with the Union Tribune. Could you be a little more specific on the next steps for reopening restaurants for dine-in service? Also, isn't the county drafting its own version of regulations for restaurants apart from the already issued state regulations? And again, are we talking about a matter of days for these restaurants?
So again, if our plan is approved, then we will move forward with the accelerated stage 2 for restaurants, and that does include dine-in, but with social distancing. So we will unveil that tomorrow at the Board of Supervisors meeting.
And Claudia from Univision is asking, along with the restaurant questions, is San Diego one of the 5 counties that will advance at a slower pace in Phase 2 the governor was referencing this morning?
Well, as I stated, we are submitting our plan later this evening, and it is for the accelerated stage 2.
All right, thank you, Dr. Wooten.
This next question deals with the USS Roosevelt, and Dr. McDonald will respond to that question.
And this question comes from Monique with CBS 8. We've learned more than a dozen sailors on the USS Roosevelt have retested positive for coronavirus after recovering. I know there are about the virus. There's a lot of details about the virus that we still don't understand, but in general, can someone explain how this could be possible?
Well, we've read the same reports in the paper. We don't have any more details than what has been just reported, which is really not too much information. And so with reference to the specifics of that situation, I would refer you back to the Navy. And we don't really have enough information to really address the underlying issue. For example, if the sailors who originally tested positive had symptoms before they were tested, or they didn't have symptoms. We know that by reports that there were a couple of negative tests after they tested positive, but the timing of those tests is unknown. It's by report that these individuals had symptoms after negative tests and then tested positive. But again, in order to really understand what's going on, we'd have to have a lot more specificity. I think it's correct that we don't understand the natural history of this disease in all people. I think we've learned a lot about this virus over time. We know about most of the clinical syndromes that this virus can present with, but we really do learn more as time goes by. And as we are studying individuals, particularly in groups like those on the Roosevelt or in other larger settings that have been tested over and over again, we may learn some new aspects about the virus, about individuals who may, for example, harbor the virus longer than they might otherwise be expected to based on what we currently know. But I would say we just have more things to learn.
Thank you, Dr. McDonald.
This next question deals with a desire for information on deaths by zip code, and Dr. Wooten will respond.
This question is from Daniel Wheaton from the UT. On April 10th, I asked the county if they would begin releasing deaths by zip code. The answer then was no, because the county argued that locations of deaths wouldn't change the public's actions. Now that the number of deaths is large enough for the county to provide some more detailed information, has your position changed?
Well, today, the position on releasing death information by zip code, we are still not doing that at this time. We will continue to evaluate when the best time to do that, but today, we are not releasing it.
Okay.
We will continue to look at when would be the best time to do that.
And then there's a question from Karen Kucher from the Union Tribune. Are county health officials concerned that churches in Chula Vista and Oceanside apparently were holding in-person church services yesterday? And is there any plan to change the county health orders as they relate to gatherings or plans to enforce the no gathering rule?
So any change in gatherings will come from the state, and we would be in alignment with that. I am not aware, or had not been aware of what has just been reported. But that type of information, if we know about it, we can take the appropriate steps in ensuring that our law enforcement is aware. And hopefully there will be, gathering is the big deal here. I know people want to meet in person, but until we get specifics or specificity on gatherings and the next phase from the governor, we will not release any gathering guidelines, or right now we are at the stay-at-home with the opening of businesses. So there is no gathering number, with the exception of childcare.
Thank you.
This next question deals with personal protective equipment, and Rob Sills, the director of our Medical Operations Center, will respond.
This question is from Chris Genuine from the Times of San Diego. SEIU protesters today say county workers don't have sufficient PPE. What is the county's response to that?
Well, we've been looking at the days that we're going to reopen county businesses for weeks now. And in preparation for that, we've been getting in additional supplies and working with each of the departments to get the total number that they need and they're requesting. And we've been sending out disinfecting wipes, face coverings, or masks or respirators if needed. And whatever the ask has been, we have been working with all the departments in order to get those out, including scanners for temperatures and other supplies. So I hope that handles the question. Thank you.
Thank you, Rob. Okay, so this one is.
This next question deals with reopening businesses, and Dr. Wooten will respond.
Yes, this one is from Mike McKinnon at KUSI. Last Friday, Dr. Wooten, you said the short answer is no when asked if you would allow businesses to reopen ahead of schedule with strict safety protocols. Today, Governor Newsom said he is empowering local health officials to decide on allowing businesses to reopen ahead of schedule. Plus, Supervisor Desmond says the data shows there are only 6 purely coronavirus deaths in San Diego County. Is that true? And will you now allow businesses to reopen ahead of schedule, or are you still against allowing them?
So those are two questions, and first we'll address the reopening of businesses. And as I stated in some earlier questions, we align with the state. So if the state provides the guidance that businesses will open, our number supports the fact that we can do that. It's not, so we will adhere and align with the governor's guidance. As opposed to the deaths, we have, as reported today, have 211 deaths A small number of individuals did not have any underlying medical conditions, but that doesn't mean that that death is a more significant death than the individuals with underlying medical conditions. This COVID-19 causes greater complications, and death is a complication when individuals have underlying medical conditions, and those include heart disease, chronic lung disease, asthma, COPD, compromised immune system, and even being an older adult puts individuals at greater risk. And for San Diego, of most of our total number of deaths, individuals do have underlying medical conditions because they are older. And so the 6 that do not have underlying medical conditions are not more significant than any of the other deaths. We have 211 deaths as reported here in San Diego. Deaths are basically calculated. They have to be reported. Well, we find out about them. They're reported to us from providers, but we also reconcile death reports with death certificates. And on a death certificate, there are 2 parts, Part 1 and Part 2. And usually, particularly if an individual has COVID-19, the first item, there's like 1, 2, 3, 4 lines for documentation in Part 1. The first line is what actually killed the person. So if someone died from respiratory distress, which was caused by pneumonia, which was caused by COVID-19, COVID-19 would be the last and the third item on that Part 1 death certificate. In Part 2 are other medical conditions that might have had contributing factors. So that's the way our death certificates are filled out, and that's the way deaths due to COVID-19 are identified and reported.
And Mike McKinnon has another question. It's
Can I just interject?
Of course, please.
There's a great video on CDC's website. It's a 3-minute video that talks about how death certificates are filled out.
Okay, great. Thank you for that. And on a kind of different, related, golfing is now allowed throughout the county, but golf instruction is not. Instruction is allowed in LA and Riverside County. Why not here? Why is golf instruction being withheld?
Well, we first started, and we were leaning forward even with that. When you have instruction, there's more touching of items, the balls, the golf clubs. So it's not currently on our allowable, but it certainly will be considered as we advance through Stage 2 and into Stage 3.
That completes our calls for today. Thank you for your participation. I want to remind everyone that we will not have a media briefing tomorrow because of the Board of Supervisors meeting, during which we'll have a full and obviously a very robust discussion on the current situation. Due to the orders prohibiting large gatherings, we cannot allow the public to attend the meeting, but you are welcome to participate and to watch online. To watch online, go to our county website at sandiegocounty.gov. You can also watch on YouTube, Vimeo, Facebook, and Twitter, and just look at look for the County of San Diego page. We'll be back here on Wednesday at approximately 2:30 for our regular briefing. And remember to stay in place, maintain space, and cover your face. Thank you very much.